Hello everyone, this is Dr. Tom Chaney from Living Health Integrative Medicine in Annapolis, back with another video. In this video, I want to discuss and help you understand type 2 diabetes in a different way. I'm going to get into the details on what that means in just a minute, but for those of you that are new to this channel, you're just getting introduced to me. My wife and I, we are the co-owners of Living Health Integrative Medicine in Annapolis. We're also authors of 2 best-selling books, Defeat Diabetes and Lose the Gluten, Lose Your Gut, Ditch the Grain, Save Your Brain. We've been here in Annapolis since 2001, helping patients improve their health naturally. We're very passionate helping patients improve their health. We see many patients that come to us that want help reversing their type 2 diabetes. They're frustrated with the conventional approach, and that's what we help many patients with. So today I want to help you understand exactly what your options are and just kind of getting your head around understanding type 2 diabetes in a different way. So let's talk about what you've been told. And this is what I hear from patients that come into my office, that they go to their provider and their annual visit usually includes them being told that they need to continue to take their medications. Maybe the medication is modified, and if your A1C is elevated, they may up your medication. And then they tell you to change your diet, tell you to lose weight, and maybe to change your diet, lose weight, they send you off to a conventional nutritionist or maybe to a diabetes educator. And then also they're going to tell you to exercise. And then if you're exercising, you're probably going to be told that you need to exercise more. Does this sound familiar to anyone out there? Because I hear this from patients coming into my office on a daily basis. This is what you've been told to do. Now, what happens is a lot of times patients, they implement these things, and unfortunately over time they see that their diabetes is actually progressing and getting worse. So what I want to do today is just get your head around understanding type 2 diabetes in a different way. And what I mean by that is let's look at this in a holistic manner. Let's look at this from the whole body perspective, not just, okay, I've got this one problem with this one area. And that's what a lot of patients, they come in with this idea. A lot of times they have the idea that this problem, this disease, it's a pancreas problem. And for most patients, it actually is not. And so when I look at a diabetic, when they come in and they present, I look at the whole body. I have to look at all the different factors that are impacting this person's health, and that's how we're actually going to reverse their disease. So, the causes of your disease it's usually just not one thing. Blood sugar regulation, it's so dependent on many different organs, glands, and systems. So in order to reverse the disease, we have to look at all these different organs, glands, and systems. And I listed some of them here. I'm not going to get into all the details. I'm just going to kind of go through them very quickly. But you've got the thyroid gland. This regulates your metabolism. So, of course, it's going to impact blood sugar regulation. Your adrenal glands, which sit right on top of your kidneys, produce cortisol. I talk more about this in other videos about how cortisol impacts blood sugar. And your gastrointestinal tract. So a healthy gut is super important to help you regulate blood sugar. And I see patients coming in with, which leads me to number 4, I see patients with infections in the intestinal lining, the gut, and that can cause other issues. So they have fungal overgrowth, they have bacterial overgrowth, and we have to handle this, and we have to get the gut healthy in order to help you regulate your sugars optimally. The liver, very important in helping to regulate sugars as well. So number 5, we see patients coming in that have a fatty liver. They've been diagnosed, and most of the time when you're diagnosed with a fatty liver, the doctor just tells you, well, we're just going to wait and watch. There's really no solutions in the conventional medical model for addressing that issue. And then the brain and pituitary gland, we know the brain runs the show, and so we do see some disconnect there and some imbalances that impact blood sugar. And then I put number 7, oh, by the way, the pancreas, because like I said earlier, most patients that come in, they don't have a pancreas problem. But it's funny that I say that because a lot of patients that have been told that they have a pancreas problem, and I look at the lab work that's been run by their conventional provider, most providers aren't looking at the pancreas anyway. and they're really just giving you an opinion of why they think this is a problem. So these are just some of the causes, and as I said, we look at the body from a holistic perspective. We look at the entire body. There's many different factors. There's no one cookie cutter plan that's going to work for every type 2 diabetic. There are some general strategies that we can apply across the board, but when you really get into that person's lifestyle, that person's causes, we have to customize it, we have to personalize it, and that's how we're able to get the results that we get. We see patients that are able to reverse this disease, meaning that they can get their A1C down into a normal range without the need for medication suppressing the number. We see patients that have lower blood pressure, cholesterol comes down, and at the end of the day, they have more control over this disease. They know, okay, now this is my long-term plan. This is what I need to do on a day in and day out basis. They're not just guessing, and we take the guesswork out of it. If you want more information, if you want to get into more of the causes, and I have a training, a type 2 diabetes solutions training. You can sign up for that. I'm going to put a link in the description below. So just go ahead and look at the description below. You can click on that link. That'll get you signed up for the training. It's a free training where we get into more of these details and talk more about how you can take control of your health instead of just feeling like you're along for the ride and you have to just suffer the consequences of this disease as it progresses and gets worse. All right, guys, I hope you got some great information from this video. I look forward to seeing you in the next video. If you have any comments, leave them down below. If you like this video, then just hit the like button, share it with your friends and family, and I'll see you in the next video.